If you clicked on this video, it's probably because either you or someone you care about suffers from back pain. Well, you're not alone. 80% of the global population experiences back pain at least once in their lives, and more than half of those have reoccurring chronic back pain. Now, many of you have probably tried at least one or even all of the traditional methods of treating the pain. I'm talking about physio, chiropractic manipulation, massage, medication, going to the gym, and the list goes on. However, despite all the efforts, the pain just keeps on coming back. First off, I must tell you that it's not your fault. These methods are not meant to fix a back problem. They are rather designed to treat the symptom of a back injury. What we are interested in is finding the root cause of the pain. So the important question we need to ask ourselves are, what got me into this position in the first place? And how can I prevent it from ever happening again? The fact is, there are many causes of back pain and a plethora of solutions. In this video, we'll be discussing only one set of reasons and their corresponding solution. The others will come later. Okay, so we'll begin with a short animation on how the spine moves in relation to all the other joints in the body. What causes back pain? Well, that's actually a complex question with many nuances. So let's start with the basics. The spine can flex to pick things up and extend to lift them. The same structure can rotate to swing a club and throw a ball. The hips can also flex and extend to pick things up, while the shoulders and hips together can rotate to swing a club and throw a ball. All this being done with a neutral spine. So which scenario is better? Well, in the first example, the spine is used as the primary mover and dominates the system. In the second example, the hips and shoulders are the primary movers, while the spine takes the energy they create and transfers it into the objects being lifted, swung, or thrown. It is thus safe to say that the second scenario is more efficient, because it better utilizes the entire body for a specific task, as opposed to overloading one system like the spine. This is functional anatomy, and the first step to understanding back pain. Along the same train of thought, let's now expand our knowledge further so that we can debunk a common myth when it comes to back pain and how we should be treating our spines. The most important point to remember is that functional anatomy cannot be properly understood by isolating a specific area like the spine while disregarding the rest of the joints. After all, the body is a system that is joined together by synergistic components. Consider the following. Should we stretch our back and increase flexibility of the spine to prevent back pain? Well, first we need to understand that we have two types of joints. The hypermobile joints of the ankles, hips, shoulders and wrists, and the less mobile, more stable joints of the knees, elbows and spine. In context, all of these joints follow a pattern which goes mobile, stable, mobile, stable, mobile, stable, mobile. We commonly use knee straps, weightlifting belts, and elbow sleeves to preserve this sequence and provide increased support for the stable joints. So based on this knowledge of functional anatomy, it makes little sense to increase the spine's flexibility when its primary role in the sequence system is to remain stable. So, as briefly explained in the animation on the joint-by-joint system, without this broad perspective, one could zoom in on the lower back and notice that it in fact can flex, extend, and rotate. One could then deduce that making the spine better at all these movements through stretching and improving flexibility is the best way to optimize performance and decrease the risk of injury. This, however, is very narrow-minded reasoning. A far better approach is to take into account the other joints upstream and downstream of the focal point, that is the spine. Firstly, notice that the hips and shoulders are ball and socket joints that can move in many different directions and have a wider range of motion than the spine. They are thus better equipped to extend, flex, and rotate. Secondly, the surrounding musculature at the hip and shoulder joints are also more powerful at producing force than the spine. Take for example the gluteus muscles, which drive the hips. These muscles are often called the powerhouse of our body because they are the biggest muscles that we have and they can generate tons of power. Now compare that powerhouse to the tiny muscles we have in our lower back. There's no comparison. So why would we want to use smaller, less powerful muscles as the primary movers of the body when we can use bigger ones? Okay, so you have highly mobile joints above and below the spine, which also have surrounding muscles that can generate loads of force at those hinges. Now this force has got to be transmitted through the body and into the environment and the objects with which we are interacting. So it's pretty obvious then that the spinal column that joins these two powerhouses needs to transmit rather than generate all the force. Look at the barbell squat as a prime example. The legs and hips generate the force, which gets transmitted through the spine and into the bar, so that one can overcome gravity and lift the barbell. The more stable the spine is, the more efficiently the force can be transmitted into the bar. The same goes for any other movement. So what's better, having a robust steel rod of a spine to do this job, or a flexible spine like a piece of spaghetti? I think the answer is pretty obvious. Okay, I assume we have all reached the logical conclusion that the spine is probably best kept stable and in a neutral shape, while allowing the hips and shoulders to do the moving and produce the force during athletic activities. We can then further deduce that compromising this natural position by excessively moving or stretching it might lead to spinal injury. This approach will serve us well when trying to make sense of the contradictory evidence and opinions in the health and wellness realm regarding lower back pain. So now that we understand the concept of the joint-by-joint system and how we should view the spine in the context of the entire body, let's now look at some practical examples of how our spine can be prevented from doing its job as a stable structure. Based on this joint-by-joint approach, let's say, for example, that your shoulder complex is super stiff. Now you try to go overhead in a shoulder press. What is supposed to happen is that the shoulders flex above the head, while the upper back extends to allow the weight to remain perfectly balanced over your center of mass. However, tight shoulders and a stiff upper back won't allow proper motion overhead, so the weight will always remain in front of the body. So what do you do to compensate for this restriction? Well, the only logical way is to forego lumbar spine stability and hyperextend the lower back. The rib cage is now flared out and the abdominals have lengthened. So you essentially switch off many of those core muscles which you have worked so hard to train in order to stabilize the spine. It's like having the best running shoes which help you finish a mile in under 5 minutes, but then you use them to try run on slippery ice, and no matter how fast you move your legs, they just have no grip with the ground to move you forward. Let's give one more example. You go to pick something up. Since we are in the weight room, let's say it's a barbell. So you start hinging nicely through the big ball and socket joints of the hips. But then you hit a wall because your hips are so tight that at a certain point, they just won't hinge any further. However, that doesn't stop you from lifting because after all, that's why you went to the gym in the first place. So the only logical way to reach the bar is to destabilize the spine and grab the bar with a rounded back. Because the hips are so tight, the spine is called on to change its primary role in the movement and do the job of the hips instead. These common occurrences were seen in a study done in Korea in which the researchers found that those of their participants who were identified as having unstable spines had significantly tighter hips than the group with stable spines. The bottom line is that dysfunctional joints above and below the spine will promote inefficient movement strategies. If the joint problem is not fixed, it will dramatically increase the risk of injury in the long run. So in this scenario, even if you know that the spine must remain straight and stable, but the primary movers, that is the hips and shoulders, aren't mobile enough, then the spine has to lose stability to complete the movement and make up for the dysfunction upstream and downstream. It's like the spine and the primary movers are swapping roles in the joint-by-joint sequence. So the short answer to the first question, what got me into this position in the first place, is that your back pain could be caused by the fact that your mobile joints aren't as mobile as they should be, causing you to compensate by using your back as the primary mover instead of a stabilizer. Now, for the second question, how can I prevent it from ever happening again? Well, as a sort of checklist, you must always check the following when evaluating a joint-by-joint sequence and how your body measures up to it. First, identify the primary role of the joint or body part, that is, whether it is responsible for stability or mobility. Then, make sure that the upstream and downstream joints are functioning properly. Finally, exercise that area of the body for either stability or mobility based on its identification from the first step. Great, so let's say that you've spent time improving the flexibility of dysfunctional joints upstream and downstream of the spine, the shoulders are nice and mobile, and the hips are restored to their full range of motion. You have also spent time doing core stability exercises. Is that it? Are you all good now? Well, not so fast. You see, when you had all those bodily restrictions and dysfunctions, you moved in a certain way. For example, maybe you habitually rounded your back when you bent over to pick something up from the ground due to tight hips. This became your default movement pattern. So the chances are that even when the hips become more mobile, that ingrained movement pattern of rounding the back will still stick. We could say that the movement patterns are like our installed software and the segments of the body are the hardware. When we upgrade the hardware by mobilizing the right joints and strengthening or stabilizing others, we then need to update the software so that it can properly utilize the hardware. So not practicing good technique and movement strategies in combination with all the mobility work and exercising is like having the latest and greatest gaming PC, but only having Windows 98 installed on it. Okay, so let's now quickly summarize what we have covered in this video. Number 1, there is no quick fix when it comes to lower back pain. The only way to rid yourself of back pain in the long term is to have the right knowledge to identify the root cause of the problem. 2, even though the spine can function in many ways, its true purpose is to remain stable in a neutral position so that power can be generated by the extremities, efficiently transmitted and transferred through the back and into the environment and objects we are interacting with. Number 3, in order for the spine to successfully do its job, the upstream and downstream joints must be functioning properly so that the joint-by-joint sequence can remain true to its intended pattern. And number 4, once the different segments of the body or hardware are functioning properly, the correct movement patterns, the software, must be learned in order to utilize the body correctly and preserve the spine. So, the short answer to the second question is that one way to prevent back pain is to ensure that the joints above and below the spine are functioning correctly, and then it's to build the correct movement patterns to ensure that spine stability is spared. Anyways, thanks for watching, and until next time, keep on exercising your health. Cheers.